Hello, welcome to Arkana Advances, where we discuss exciting new research in renal pathology performed by our own physicians. I'm Dr. Rebecca May, and today we have Dr. Clarissa Cassol, who will be discussing her recent brief communication in Kidney 360 titled Viral-like Inclusions in COVID-19 Negative Renal Biopsies by Electron Microscopy. Thanks so much for joining us, Dr. Cassol.
You're welcome. It's a pleasure.
So this was published in August of 2020, only a few months into the pandemic here in the United States. Can you discuss what was being published and talked about in the renal community about direct infection of renal parenchyma by COVID-19 around that time?
Yeah, so there had been a couple papers coming out, both autopsy series and biopsy series, and with a lot of, electron microscopy pictures depicting what appeared to be viral particles in the kidney cells, mostly tubular epithelial cells, some even in the podocytes. And, I was a little bit puzzled by those images, and did they really represent viral particles? Because we see, those type of similar images very often. So that was, the motivation behind, and not only in the kidney literature, but, I was even more concerned about some other organs like endothelial cells and, subspecialties that don't really see a lot of electron microscopy, and then people, get excited because they don't see it that often and think that those are viruses. I mean, it's an easy mistake. So that was the motivation behind systematic looking for those in a small sample, just, to get the word out that, maybe these are not viral particles.
Yeah, because kidney pathology is one of the few fields that really looks regularly at electron microscopy.
Exactly. Yeah. So, I don't blame, other people just, are not familiar with that, and, they really look alike.
Mm-hmm. So you decided to see if these viral-like particles were present even, before the pandemic in other areas. So what clinical cases did you choose for your analysis?
Yeah, so I tried to select a few that were, clearly before the pandemic, so there was no risk that, there could be coronavirus there.
Yeah.
And I selected, a mix of allograft and native kidney biopsies with different pathologies, different diagnoses. Just to basically systematically look for those and see if we could find those exact morphological particles in clearly known COVID-19 patients. So that's our set. We had a total of 15 biopsies.
And so what did you find when you looked at those 15?
So it took a while, and I thank Dr. Barn for going to the electron microscope and scoping all those cases and taking pictures. It was a lot of work, but we were able to find those very similar particles in all of those cases. Yes.
So you found things that were similar to what were being published and said were COVID-19 viral particles. You found those in all cases that were known to be either COVID negative or pre-pandemic.
Exactly, yes.
Wow, that's really impressive. So you also took it a step further. You did COVID-ish in renal biopsies from patients with active COVID, right?
Yeah, so just to reinforce that point that, COVID is not directly infecting the kidney, we did started to get some biopsies that were from known COVID-19 patients. So we decided to also prove the other way around, doing ISH, to see if, it would stain, and none of those cases stained for in situ hybridization against COVID-19.
So in some of the cases that had been published, they had detected it when they looked at whole tissue samples. But this could likely be from viremia, right? From viremic states where it's in the blood and then gets into the tissue.
Exactly. That's why it's so difficult to really prove direct tissue infection in any organ, not only the kidney, because every organ is perfused. And so if blood is there and you use the whole tissue lysate to look for the virus, you can just be finding, virus that is in the blood, not directly in the tissue, infecting the tissue cells.
So these particles that you found on EM that were mimics, what are they?
That's a tough question. I cannot completely tell you what they are. We have some hypotheses and, a few that seem more likely are endocytic vesicles, especially those that are clathrin-coated, because the coating proteins around the vesicle may resemble a spike, a corona spike. Other, possibilities, microvesicular bodies containing exosomes that are directed to go out to be released in the cell surface. But even, other small intracellular organelles could be mimickers, but I think those are most likely.
And these are all around the same size as coronavirus,
Exactly,
right?
yeah. And the viruses have a range of sizes, which, makes it even more easier to mimic by organelles, which also, have a different range of sizes.
Right. We think about things like this as it's a virus. It must have the same exact size inside the cell, right?
Yeah.
But it's actually a range of different sizes that you can see.
Because their covering is a little bit pliable and soft, and that's why it varies. But one thing to notice is that they are not going to be greater than 200 nanometers. They are usually between 60 and 140, because that's a different size range of viruses family.
And what's interesting is looking back at prior outbreaks, like the 2003 SARS outbreak, we also saw a similar thing happening in the literature, right?
Yeah, so and actually, back in 2003, it was actually Electron Microscopy who helped identify that coronavirus at the time. What they did is that they got nasopharyngeal samples from patients that were infected, and they applied those to cell cultures. And then when those cell cultures started exhibiting cytopathic effect, they embedded them in thin sections for electron microscopy. And under the electron microscope, they saw those particles. And because they had the corona, they presumed that was a coronavirus. So they went back and tried like PCR with, common coronavirus proteins that they were known. And that's how they initially discovered the 2003 coronavirus.
Oh, wow.
It was through electron microscopy. But that was like a very, detailed work. And there were other reports at the time that were just doing electron microscopy on clinical samples, tissues, GI tract, and then seeing those, microvesicular bodies or other organelles and claiming that those were viruses.
So at that time, the CDC actually put out a recommendation, right, that instead of just looking at EM, you should really be doing immunoelectron microscopy or ultrastructural-ish.
Yes,
right?
Exactly, to really document that the viral proteins or viral RNA was there in those particles that morphologically looked like viruses or virions.
And that's an extremely complicated thing to do, right?
Yeah. I could not do it here, and I don't think many people do it.
No,
it's very hard.
Doing RNA-ish or IHC is a much simpler process than going on the EM specimen.
Yes, but they even released some recommendations lately that even when you have in situ hybridization positive, you should ideally try to examine that same tissue under the electron microscope to prove that whatever is being detected by ISH is in the tissue cells and not in the blood vessel or,
Yes.
But that's going to be tough,
Yeah, I think that's going to be hard to take that same tissue and That's a difficult process.
Yeah.
And another historical interesting fact that you wrote about in the paper was that this sort of confusion using electron microscopy also occurred in some earlier studies of cancer, right, in the 70s?
Yeah, exactly. Because, at that time, there was no immunohistochemistry, and people were really keen at studying cancer cells through electron microscopy to try and, understand better. And of course, those cancer cells are very active. They have different, organelles and vesicles. And many people have claimed to, have found, viruses in breast cancer cells. There was, for a long time, a theory that there was like a breast cancer tumor virus, but they were never proven. So I think, it's the same challenge with mimickers.
Yeah. So this is a really interesting paper. And so you've shown that we really can't use these viral mimics on EM to prove infection. And you did some-ish showing you didn't see any direct viral infection, but that doesn't necessarily prove that kidney cells are not directly infected, right? It just we haven't shown it yet.
Yes, exactly. And there is a possibility, if you do electron microscopy, that you can see those viruses. There was a recent paper that was published by some authorities in the field that, clearly establish how should you, go around. For instance, a lot of people look at vesicles with spikes around spikes between quotation marks and think those are virions. But actually, if you know of the biology of coronaviruses, when they are inside the cells, they are inside vesicles to replicate. And so those spikes are not going to be actually showing out. They're going to be facing towards the inside of the vesicle. So that's, completely, if you see the spikes, then you're inside the cell, it's more sure that they're not viruses. And even when they are outside, the spikes on routine electron microscopy are not very easily to visualize. You need to do like a special staining with tannic acid to be able to see those spikes. Otherwise, they just look like a fuzz and not real defined spikes. So, there is a lot of really good work done by, CDC experts in detailing all the biology of the viruses and how they replicate inside the cells. And if you want to be able to identify those, you could technically use EM, but you have to follow those principles that the CDC has outlined.
Wow. So this is so important to learn and get out there, not to repeat some of these mistakes of the past again during this current pandemic.
Exactly. It's scary because, people read medical articles these days on the internet, and then, if people claim, there is endothelial cell infection, there is this type of cell infection, and it's not really proven. That was the whole objective, to just put it out there, to be cautious about it.
This is great. So thank you so much for publishing this study and reminding us to be really careful about the science that we're doing, especially during such a high stress time.
Exactly.
So if you'd like to learn more about research that's happening at Arkana Labs, visit our website or follow us on Twitter at Arkana Labs for exciting kidney news and research updates. And do you want to give your Twitter handle?
My Twitter handle is at Clarissa Cassol.
Great. Thank you so much.